In December 2022, one of the most recognized voices in the world went silent. Not by choice. Celine Dion had been performing for 50 years. From the stages of Quebec to the Las Vegas Strip to stadiums on 6 continents. Her voice was, by almost any measure, one of the great instruments of her generation. And then, in an emotional video posted to her Instagram, her voice breaking, her eyes filled with something between relief and grief, she finally told the world what had been happening. "I've been dealing with problems with my health for a long time," she said. "These spasms affect every aspect of my daily life, sometimes causing difficulties when I walk and not allowing me to use my vocal cords to sing the way I'm used to. The diagnosis, stiff person syndrome, a condition affecting roughly 1 in a million people. A disease that most primary care doctors have never seen in their careers. A condition with no cure, no single clear cause, and, until that December morning, almost no public profile at all. What Celine Dion did by speaking out was give a name to a silent epidemic of misdiagnosis and suffering. And what happened next is a story about what it costs to the body, to the mind, and to the medical system when a disease takes 7 years to identify. What it actually does. Stiff person syndrome is not stiffness the way you feel it after a long run, or the morning ache of getting older. It is something fundamentally different. Something that people who have experienced it describe with the same words, again and again, regardless of where they live or how old they are. It is like being strangled from the inside. Imagine your back muscles contracting, not because you've injured them, not because of posture or strain. But suddenly, without warning, with a force that feels like steel cables tightening around your spine. The muscle doesn't release. It doesn't follow the normal command to relax. It simply stays contracted, pulling bone against bone, locking joints, making the simplest movement, turning to look at someone, bending to pick something up, nearly impossible. In severe cases, the spasms are violent enough to fracture vertebrae, to dislocate joints, to throw a person to the ground from standing. One moment you are walking, the next you are on the floor, unable to get up, your body rigid in positions it was not designed to hold. What triggers a spasm can be almost anything. A sudden loud noise, an unexpected touch, emotional stress, the cold, the anxiety of anticipating a spasm, which creates the spasm, a cruel feedback loop that the condition builds into its victims over time. The muscles most commonly affected are in the torso, the back, the abdomen, the chest. But the disease can spread to the limbs, and in cases like Celine Dion's, to the muscles controlling the vocal cords. Imagine being a singer. Imagine the instrument you have spent your entire life refining being taken from you, not by anything you did wrong, not by injury or illness in the conventional sense, but by your own immune system. Quietly dismantling the neurological infrastructure that allows you to breathe deeply and sing. That is stiff person syndrome. And it was first identified in 1956, nearly 70 years ago, and medicine is still, to this day, unable to cure it. The history from stiff man to a spectrum. The condition was first formally described in 1956 by 2 American physicians who noticed that some patients developed an unusual pattern of symptoms, progressive muscle rigidity in the trunk and limbs, combined with violent involuntary spasms triggered by external stimuli. They called it stiff man syndrome. The name reflected not just the era's assumptions about who got sick and who reported it credibly. It would later emerge that the condition occurs significantly more often in women, but also how little was understood about the underlying mechanism. It was a descriptive name. A name for what doctors could see, not for what was actually happening inside the nervous system. For decades, the condition languished in relative medical obscurity. The patient population was tiny. The symptoms were strange and varied enough that many patients were misdiagnosed repeatedly before ever reaching a specialist who recognized what they had. The condition was renamed stiff person syndrome in the 1990s, a deliberate correction to reflect the demographic reality. And it was reclassified, as research accumulated, from a mysterious movement disorder to what it is now understood to be a rare autoimmune neurological disease. One where the immune system has, for reasons still not fully understood, turned its machinery against the brain's ability to tell muscles to relax. The science, the immune system at war with itself. To understand what is happening in stiff person syndrome, you need to understand one of the brain's most fundamental operating principles. The nervous system runs on a constant negotiation between excitation and inhibition. Neurons fire, that is excitation. And then, critically, they are told to stop firing, that is inhibition. The balance between these two states is what allows your muscles to move and then, equally important, to relax. The primary chemical responsible for inhibition in the central nervous system is called GABA, gamma-aminobutyric acid. GABA is the brain's main stop signal. It is what tells overactive neurons to stand down. It regulates muscle tone, anxiety, stress responses, and the startle reflex. To produce GABA, the brain relies on an enzyme called glutamic acid decarboxylase, GAD. Specifically, a variant called GAD65, found in the synaptic vesicles of neurons. The tiny structures that release neurotransmitters into the gaps between nerve cells. In people with stiff person syndrome, the immune system produces antibodies against GAD65. Those antibodies attack the enzyme responsible for making GABA. When GAD65 is impaired, GABA synthesis drops. When GABA drops, inhibitory signals weaken. And when inhibitory signals weaken, the motor neurons controlling muscles no longer receive the command to stop firing. They fire continuously. Agonist and antagonist muscle groups, muscles that normally work against each other to produce controlled movement, activate simultaneously, locking joints in rigid, painful contraction. The startle response, normally a split-second reflex that resolves immediately, escalates into a full-body spasm that can last minutes. Research has confirmed this mechanism directly. Studies measuring GABA levels in the cerebrospinal fluid of SBS patients found them significantly lower than in healthy controls. The antibodies are not just present, they are measurably reducing the brain's inhibitory capacity. In most patients with SBS, GAD65 antibody titers in the blood are more than 10 times higher than anything seen in healthy individuals, or even in patients with type 1 diabetes. The only other major condition associated with these antibodies. In SBS, those levels can be 50 times higher, 100 times higher. The immune system has mounted a specific, sustained, precisely targeted assault on the enzyme that keeps the nervous system calm. And medicine still does not know what triggers it. 7 years. That is the average time from the first symptom of stiff person syndrome to a correct diagnosis. 7 years of being dismissed, misdiagnosed, referred to psychiatrists, to physiotherapists, to rheumatologists who had never encountered the condition and defaulted to the diagnoses they knew. Multiple sclerosis, Parkinson's disease, fibromyalgia, functional movement disorder, the clinical term for we think this might be psychological. The reasons for the delay are multiple and compound. The disease is rare enough that most primary care physicians have never seen a single case. Symptoms are highly variable. The stiffness may begin in one leg, or the lower back, or the abdomen, presenting so differently in different patients that pattern recognition is nearly impossible without specialist experience. The psychiatric symptoms, anxiety, phobias, depression, are genuine features of the disease, not reactions to it, which means that patients are frequently offered mental health referrals before neurological ones. And there is a documented, gender-specific element to this delay. The SBS Research Foundation, advocates, and affected patients have repeatedly described a pattern in which the symptoms of women, the back pain, the anxiety, the episodic nature of the condition are attributed to stress, to hypochondria. to psychosomatic causes, long before anyone orders a GAD antibody test. One National Geographic report quoted a researcher directly. There are lots of stories, particularly of women, who have had a very hard time getting anybody to take their stories to be credible. The cases document this pattern starkly. A 60-year-old man spent 10 years with progressive paraspinal muscle spasms and lower limb weakness before receiving an SBS diagnosis, a decade of wrong treatments, incomplete investigations, and functional decline that might have been slowed had the correct diagnosis arrived earlier. A teenager was diagnosed after several years of pain and mobility problems. His parents, both physicians themselves, acknowledged it still took 2 years and countless specialists to reach the answer. 2 years, with parents who knew exactly how to advocate within a medical system. Most patients have neither the knowledge nor the access to navigate it that efficiently. Celine Dion said in her video that she had been dealing with problems with my health for a long time before the diagnosis came. The exact duration of her journey to diagnosis was not specified publicly. But the phrasing "a long time" is the phrase SBS patients use everywhere. Treatment, what exists and what doesn't. There is no cure for stiff person syndrome. What exists is management. Symptomatic relief. A careful, ongoing negotiation between the disease and the treatments available, aimed at preserving quality of life, rather than eliminating the underlying cause. The first-line approach is medications that enhance GABA, specifically benzodiazepines like diazepam, which work as GABA-A receptor agonists. By boosting the brain's inhibitory chemistry from the outside, these drugs can reduce muscle rigidity and the frequency of spasms. In some patients, the doses required are high enough to cause significant sedation, limiting function in other ways. Baclofen, another GABA-enhancing agent, used widely for spasticity, is a common second option, sometimes administered directly into the spinal fluid via an intrathecal pump to minimize systemic side effects. The immune-targeted treatments are where the most meaningful progress has been made. Intravenous immunoglobulin (IVIG) works by flooding the system with healthy antibodies that effectively dilute and disrupt the abnormal GAD65 antibodies driving the disease. A study published in Neuroimmunology and Neuroinflammation found that approximately 67% of patients responded to IVIG treatment over a 3-year follow-up period, with measurable improvements in gait, posture, painful spasms, and startle response. Rituximab, a more potent antibody-targeting drug, has shown results in some patients, particularly those with more severe or progressive disease. Physical therapy, occupational therapy, and the deliberate management of environmental triggers. Reducing sudden loud noises, unexpected physical contact, emotionally stressful situations all play roles in slowing functional decline. None of it cures the condition, but for many patients, it is enough to live with. Celine Dion, the moment everything changed. When Celine Dion posted her video on December 8, 2022, something happened that rarely happens in rare disease advocacy. The world paid attention. Not just the stiff person syndrome community, which had existed in near invisibility for decades. Not just the medical specialists who had been quietly treating these patients with limited resources and limited public support. Everyone. Within days of her announcement, online searches for stiff person syndrome increased dramatically. The Stiff Person Syndrome Research Foundation received an influx of donations and inquiries. Neurologists across the country reported patients who had been living with unexplained symptoms for years suddenly calling to ask whether this might be what they had. Jim Weiss, whose son Michael had been diagnosed with SBS as a teenager. A 2-year journey, even with 2 physician parents advocating for him, described the impact directly. Celine's announcement also took real courage and personal strength. This has been helpful to many individuals with SBS, lending credibility and support to people who are so often misdiagnosed and viewed with skepticism. 1 in a million is a number that sounds small until it describes your life. In the United States alone, that means approximately 330 people are living with this condition at any given time, based on known prevalence estimates that specialists widely believe undercount the true figure. Worldwide, thousands more. Many of them diagnosed with something else. Many of them still searching. In May 2023, Dion canceled the remainder of her world tour entirely. In June 2024, she released a documentary, I Am, Celine Dion, that showed, for the first time publicly, what a spasm actually looks like. The footage was raw and shocking. A woman who had spent decades commanding stages reduced, in a matter of seconds, to a body that had turned against itself, muscles clamping down, breath compressed, pain visible in every line of her face. And then, on March 30th, 2026, her 58th birthday, she announced she would be returning to the stage. Performing in Paris, starting in September 2026. The disease had not been cured. But she had not surrendered to it either. The close. There are conditions that science understands completely and cannot cure. There are conditions that science can cure but doesn't fully understand. Stiff person syndrome occupies a third category, a disease that is partly understood, partly treatable, and still, after nearly 70 years, the subject of more questions than answers. What triggers the immune system to produce GAD65 antibodies in the first place? Why do some people develop stiffness in the torso while others lose mobility in a single limb? Why do some patients respond to IVIG and others plateau or decline? Why does the disease affect women more than men? Medicine doesn't know. What it does know is that for the patients living with this condition, the journey to understanding what is happening to their body can take 7 years. 7 years of being told their pain is stress. 7 years of being referred to psychiatrists for a neurological disease. 7 years of watching their mobility narrow while the correct test, a blood draw measuring GAD65 antibody titers, sits unused because no one thought to order it. The thing that changed that, at least a little, was a singer standing in front of a camera with tears in her eyes, telling the truth about her body. All I know is singing, Celine Dion said in 2022. It's what I've done all my life, and it's what I love to do the most. In September 2026, she plans to sing again. For the patients watching, the ones still waiting for a diagnosis, still fighting to be believed, that matters for reasons that go beyond music. Stiff person syndrome has existed since at least 1956. Most doctors have never seen a single case. And the only reason most people outside the medical community have ever heard of it is because one person decided to speak. If this channel is where you find the conditions medicine overlooks, subscribe. And comment below. Did you hear about SBS before Celine Dion's announcement? I genuinely